What do you think was more dangerous in the 1800s, the disease or the surgery meant to cure it? The answer might surprise you. Through one remarkable painting, we're about to witness how surgeons operated in an era when washing hands was considered optional and anesthesia was a new experimental idea. This is the story of Thomas Eakins The Gross Clinic and how it pulled back the curtain on 19th century medicine. Let's dive into this fascinating painting where art meets medicine. Dr. Samuel Gross stands there, larger than life, his blood-stained hands holding a scalpel that gleams under the skylight. What makes this painting so extraordinary is the raw, unfiltered reality it presents. This was a time when most artists were painting idyllic landscapes or flattering portraits. Instead, Eakins chose to show us something real. Blood on fingers, surgical instruments in action, and a patient under ether anesthesia. It was so realistic, so shocking for its time, that it was rejected from the 1876 Centennial Exhibition's art gallery. Can you imagine? They had to display it in a military hospital instead. But this rejection tells us something crucial about the 1800s. People weren't ready to face the reality of medicine head-on. They preferred their art sanitized, their medicine hidden behind closed doors. Yet here was Eakins, pulling back the curtain, showing us exactly what happened in those surgical amphitheaters where the future of medicine was being shaped. The drama in this painting is palpable. Look at the woman in the background, traditionally thought to be the patient's mother, covering her face in distress. This single feature captures the emotional weight of 19th century surgery, when family members had to witness operations and consent to each step. Meanwhile, Dr. Gross stands calm and composed, demonstrating a new technique that could save limbs instead of amputating them. Think about that contrast for a moment. In one corner, we have raw human emotion. In another, cool scientific progress. This wasn't just a painting. It was a statement about medicine's evolution from a crude practice to a respected science. And Eakins captured it all, right down to including himself in the scene, sitting among the students, sketching just as carefully as Dr. Gross was operating. Let's break down what surgery really looked like in those days. First, forget everything you know about modern surgical attire. No scrubs, no surgical masks, no sterile gloves. Dr. Gross and his assistants operated in their street clothes. Those heavy black frock coats that would become caked with blood and other fluids throughout the day. They didn't change between surgeries. In fact, the more stained their coats became, the more experienced they were considered to be. The painting shows us something revolutionary for its time: the use of anesthesia. See that cloth over the patient's face? It's soaked in ether, one of the earliest forms of surgical anesthesia. Before the 1840s, surgery was a nightmare of conscious pain. Patients were held down while surgeons worked as quickly as possible. Speed was more important than precision. The introduction of ether and chloroform changed everything. Suddenly, surgeons could take their time, work carefully, and develop more sophisticated techniques. Look at how Dr. Gross is positioned in the painting, lecturing while operating. This was typical of surgical theaters in the 1800s. They were literally theaters with tiered seating where students and other observers could watch and learn. Surgery was a public spectacle, a performance as much as a medical procedure. And Philadelphia, where this scene takes place, was at the forefront of American medical innovation. The operation itself tells us volumes about how surgery was evolving. Dr. Gross is performing a relatively new procedure to remove infected bone tissue, osteomyelitis of the femur. In previous years, the standard treatment would have been amputation, often leading to death from shock or infection. But here's Gross, demonstrating a conservative approach that could save the limb. This was revolutionary thinking for its time. But let's not romanticize it too much. The reality was still brutal by today's standards. Without proper understanding of germ theory, that would come later, infections were common and deadly. Surgeons operated with bare hands, often moving from patient to patient without washing. They prided themselves on their quick, decisive cuts, made necessary by the limitations of early anesthesia and the constant threat of infection. The surgical instruments visible in the painting, the scalpels, retractors, and clamps, weren't so different from what we use today. What was drastically different was how they were used and cared for. There was no autoclave sterilization, no disposable instruments. Tools would be wiped clean, perhaps rinsed, and used again. However, the Gross Clinic isn't just a window into medical history. It's a masterpiece that forever changed how art could engage with science and medicine. When Eakins painted this scene, he wasn't just documenting a surgical procedure. He was making a bold statement about the relationship between art and reality, between observation and understanding. Consider the artistic choices Eakins made. The dramatic lighting, with Dr. Gross illuminated from above as if by divine inspiration, turns a bloody surgical scene into something almost religious. Eakins was deliberately elevating modern medicine to the level of classical artistic subjects. He's saying that the work of healing, of scientific progress, is just as worthy of artistic attention as any biblical scene or royal portrait. The level of detail in the painting is astounding, and it comes from Eakins's unique background. He didn't just observe surgeries. He studied anatomy himself, attended medical lectures, and even participated in dissections. This wasn't common for artists at the time. Most would have considered such direct exposure to the body unnecessary or even distasteful. But Eakins believed that to paint truth, you had to understand it completely. Look at how he handles the blood on Dr. Gross's hands. It's not sensationalized, not minimized. It's simply there, as matter of fact as the surgeon's stern expression. The red paint becomes both literal blood and a symbol of the surgeon's work. This dual nature, both brutally real and deeply symbolic, is what gives the painting its lasting power. The inclusion of Eakins himself in the painting, sketching in the background, creates a fascinating parallel between surgeon and artist. Both are observers, both work with their hands, both seek to understand and represent the human body. It's as if Eakins is saying that art and science are two paths to the same goal: knowledge. When the painting was first exhibited, many critics were horrified. But these reactions tell us more about the viewers than the painting. They weren't ready to see medicine presented this way, as something both brutal and beautiful, both scientific and human. Today, we understand that this is exactly what makes the painting so powerful. The Gross Clinic's influence extends far beyond its time. It helped establish American art as equal to European traditions, proved that contemporary subjects could be as compelling as historical ones, and showed that realism in art could be both technically precise and emotionally moving. It's now considered one of the greatest American paintings ever made, and its recent sale for $68 million shows that its value, both artistic and monetary, has only grown with time. From this masterpiece, we can draw a direct line to modern medical illustration, to photographs of surgeries, to the entire genre of medical documentation through art. Eakins showed us that there's beauty in truth, even when that truth isn't pretty. He proved that art could serve science without losing its soul, and that the human body, in all its vulnerability and resilience, is worthy of our closest attention. If you found this exploration of medical history fascinating, you're going to love what's coming next on our channel. Make sure you don't miss out by hitting that subscribe button below and turning on the notification bell.